When somebody's diagnosed with HIV, it's a very, very difficult world to navigate. A lot revolves around telling people that you're HIV positive. For example, at what stage do you tell somebody that you're interested in that you're HIV positive? Is it before you kiss them? Is it after you kiss them? These questions face people every single day. We've come a long way really since I started in 1992 in terms of bringing HIV to the public attention. In the early days, it was very much musicians and poets and artists who supported us.
HIV Ireland has had to adapt over the years to how this crisis has developed and how it has changed medically and how people are living longer and how we have to provide those services that we didn't perhaps in the past have to consider. There is still a crisis. There's still increasing numbers of people who are testing positive, who need services and who need advocacy for them in the community. And most particularly as people are living longer and having to live with the illness, we have to deal with stigma, and therefore an organisation like ours in the public eye can help.
We really have a lot of varied supports for people living with HIV, counselling, one-to-one. We operate a testing service called Know Now. It's a rapid testing service primarily engaging gay men. It's provided by gay men in social spaces that gay men frequent, and people get the results in 1 minute. Now we have, I suppose, a more sophisticated look at training in that we are training people who are working with marginalised groups who are then using that information to train others. We're very innovative and creative, and I think we have a history of being able to kind of find out the gaps and fill those gaps and meet those needs. I think in terms of our very unique outreach program with migrants, which is a street program, targeting migrants who may be unconnected to services. From the very beginning of the inception of our organisation, really the point of HIV Ireland is really to make ourselves redundant. I mean, we are working to see a time when nobody is contracting HIV, which is 100% preventable, and also a time where people aren't affected by HIV stigma. That would be our ultimate goal.